Okay. Good afternoon, everyone. So this is Thursday, January 23rd at 4:04 p.m. and we're in 2025. This is the Council for Human Services meeting. My name is Veronica Bolchik and I'm the chair. And the first thing I'd like to do is to establish quorum. Before I do that, I just want to say we are doing this meeting today at a 100% virtual. We were scheduled to be in the trailer, but we had a quick shift today. So um, we are 100% virtual. Next month, we'll go back to our hybrid fashion. And there is good heat and good air conditioning now in that trailer. As of last Friday, I showed up with a blanket and it was quite warm in there. It's nice and toasty, so no fear of freezing or dying of heat, which just tells me that that trailer is going nowhere. It's not
Exactly.
temporary, not temporary. Anyway, so here we go, establishing quorum. I'm going to read from the screen here. So Sue Minthinen
Present.
and Amanda Wright,
Present.
Tara Restieri,
Present.
Kelly Steffen,
Present.
and Sarah Wright.
Present.
Present. And myself, Veronica, we do have quorum. I do want to also introduce our staff members today. We've got Jericho Maley.
In attendance, and
And I
Lexi is
assume-
actually out sick today.
Okay, so that town committee 2 is just a blank screen.
I had to, long story short, I had to log in 2 separate places to get the meeting up and running. So
Okay, so we don't
this is
have Lexi is not with us then.
correct.
Okay. All right. So we have Jericho Maley as our town representative and our administrator. So I believe that's everyone. I don't think we have any members of the public. 2, 4, 6, 8. So I see there's 8 participants. We have 8 there.
I have a question.
Yes.
Jericho, do you need to turn on the AI thing?
We did not get that logged in, so I'm gonna actually do
Okay.
an experiment where I feed this file directly into it to see if it can do it that way. We've actually been asked to explore a variety of minutes technology. So the health department is testing this circle back AI, kicking the tires on it because it looks like it'll lead to a single minutes solution for all of the boards at a central town level.
Okay.
Cool.
Thank you. All righty. Can we have an acceptance of the agenda?
So moved.
Second?
Seconded.
Thank you. So for a vote, Sue Minthinen,
Yes.
Amanda Wright,
Yes.
Tara,
Yes.
Kelly,
Yes.
Sarah,
Yes.
and myself, yes. So we've accepted our agenda. Next item is approval of minutes. We have minutes from 11/21/24, which were sent to you with the agenda and the meeting notice. Can I have approval of the minutes?
So moved.
So moved.
Second?
Second.
All right. And by the way, because we are virtual, all votes have to be done by roll call. So Sue Minthinen,
Aye.
Amanda,
Aye.
Tara,
Aye.
Kelly,
Aye.
Sarah,
Aye.
and myself. Aye. So we've approved those minutes, and Lexi's been doing a fabulous job with getting minutes and keeping us up to date. Just want to make recognition of her hard work in getting that done. So I assume we have no public comments since we don't have any public here. All right. Okay.
I will say, Veronica, just to let you know, I've been spreading the word that there's an opening on CHS and trying to recruit. So
Okay. Thank you.
I think I have one person who hopefully is doing her application like ASAP.
Okay.
Awesome.
Those applications are due February 7th, and then it'll go through a process. They get read at the town meetings, or excuse me, the select board meeting, I think twice, and then they'll have a vote. I assume by end of February that will be done. I assume, but I haven't seen a timeline on that. But I appreciate everyone's effort in shaking the trees, because we do want to have a full committee, especially with what we're going to be coming up with in the next couple of months. So thank you. Thank everyone's effort on that. All right. So we're on to reviewing the CRC process and an overview of the grant submissions. So Contract Review Committee has been diligent in meeting on, we've selected Friday mornings at 9 to roughly 11, sometimes 12 to be our regular meeting time. That has worked very well because we have very busy people and getting that commitment. And if we have a meeting, you know that you have to be there on Friday. And if we don't, then you have a free Friday morning. But at this point, we have, the grant application went out. We received submissions. Before we actually had the submissions received, we did a bidders information session, which some people here attended that also, which was fabulous. And one thing that we have noted now that we've gone through reviewing the applications, and we also just completed interviews with the majority of grant applicants. We basically, rather than just blanket interviewing everyone, we said if you were a new organization, we wanted to have just a face-to-face, and it could have been done Zoom or in person, the opportunity to ask questions. If it was over a certain dollar amount, we also had, or if we had specific questions. And with that, I think there was all but maybe 5 organizations that we did not, but we did offer them the opportunity to come in. And just 3?
I think the
Okay.
only ones who did not were either not asked to come or did not volunteer was South Coast Legal and Star. South Coast Legal, Star, and
Nope, Star did do it. It was South Coast. We had ASAP did not.
MVCS, Martha's Vineyard Community
Martha's
Service.
Vineyard, and also Meals on Wheels.
Oh yeah, Elder Services, correct.
The
So
service.
four, and I think we had 17 grant requests this year, and 13 of them came to doing a presentation.
Right. And not coming for an interview did not affect, it doesn't affect the outcome at all. It's just that we have some grant applicants that, it's something that we're all very well familiar with. And leading up to that, we assigned each grant applicant to 1 or 2 of the committee members to dive down deep into it and, if necessary, ask questions at that point. So, so far we finished our application and all the interviews. And next Friday we will go into deliberations, with the goal of completing that next Friday. So it may be a long day, but I hope that we finish that, and then it'll be writing the report and submitting that to the town and to finance, meeting with finance probably the beginning of March is what we're targeted at this point. And so that'll be completing this process. As usual, we have much more ask than money to give. And I don't have my statistics here, but I'm going to say it was almost, I think it was maybe 1.2 million for $650,000. We did have in the interview process, we had one applicant resubmitted a a budget and lowered their ask significantly. One thing that we learned this round, we did not publish ahead of time how much money we had. And we had one applicant ask for $300,000, which is almost half of what we have. Um, Fabulous idea, but they have reduced what they're asking in the 800, in the, I think eight, no, excuse me.
80.
80 as opposed to 300. So we recognize that we need to have more money. And we, on our contract review committee, we do have a member of the finance committee. So she is guiding us in how we approach getting more money. So when we do our presentation to finance, for what we're asking for this year, which is 650 in the human services grants and 175 in the substance misuse grant, we will be asking at the same time for more money in the fiscal year 27 cycle, which will be the next grant round. So the month of March is going to be a pretty busy month with putting that together. And Jericho, yes.
I was going to add that there is the additional opioid money, the opioid remediation money, which will be which the current plan is to do an abridged single award of, I think, around $50,000 to, under the guidelines through the opioid remediation settlement. The idea is to do that in March, April, so that we have it ready. We have probably April to early May, so we can have it in the fiscal year 26 budget that will be coming up. So we'll have an additional 50 to 55. I can't remember the exact number, as the first tranche of the various opioid settlements. That particular grant has more specific guidelines than the contract review committees do. It's much more limited in its use cases. There aren't a lot of organizations on Nantucket that can apply for it or that are currently providing services that fall under its remit. But that means it'll be a quicker turnaround for a grant writing process. So basically, the idea is to publicize that locally on Nantucket, probably starting as soon as we have it confirmed that that money is being allocated in that way, to give everyone a nice head start, and then release the RFP probably sometime at the beginning of March to collect either in April, to then do a like 2 or 3 week evaluation process. My suspicion is we'll get 2, maybe 3 grants. We won't have to deliberate on amounts. It'll just be who we award to.
Right. Do you have the parameters for what that money can be used for?
Not 100%. This is a collection of about 4 different settlements, which have largely similar requirements or restrictions, but I haven't gotten from finance the like all of the which part of the Venn diagram overlap all of the settlement money goes into. So if we're doing a settlement, like a single issue, that means we're combining monies from a couple of different individual settlements, which means that we have to follow the application guidelines for all of them. Brian told me that shouldn't be a particular problem, and I'll have the specifics of what their recommended target areas are, and then the restrictions on the funding. But that should be forthcoming next couple of days. And I'll share that with you as soon as I get it, Veronica.
Okay. So I guess I'm trying to just narrow in, is it going to be for medical? Is it going to be for education purposes?
So I think it's closer to the treatment. It doesn't necessarily need to be Matt or what is it? The new Sarah, you might be able to help me out on this. There's the new office-based treatment. I forget what the actual acronym is, but there's a couple of new protocols coming out. And then I think there's some specific harm reduction usages that it's okay with. Did I get that right, Sarah?
I'm sorry, Jericho. I was momentarily distracted because I think Suzanne Keating's trying to get in to the meeting. So sorry. But I will have to get back to everyone on that. I know Rosemary, I think, mentioned something about this to me recently as well.
Okay.
I think that's who told me.
Okay.
Here's Suzanne.
But hi, Suzanne.
Hi, Suzanne. You have to unmute yourself for a second.
Hi.
Okay. Hi, Suzanne. So Suzanne has joined us at 4:19 p.m. Thank you for making it, Suzanne. Sorry if there was a little bit of a hiccup.
I
in
went to the thing. I didn't see the email
No.
that it was all virtual. So I
Oh.
just got home. I've been over at the trailer
Oh,
waiting for
Oh.
someone to let me in, but nobody was there.
I'm so
Oh.
sorry, Suzanne.
It's my fault. I don't check my email when I'm at work. So
Yeah, I really should have. I'll try. If we have another same or 24 hours, I'll try and get the phone chain going just as a backup. A
Cool.
lot of people don't have their job staring at an inbox all day, so I want to be a
Yeah,
little
I
more
don't.
respectful of that.
Apologize for that, Suzanne, but thank you for making the effort. All right.
Did you call? Do you need me to say aye or anything? Like I'm
No, not at this point.
Okay.
We'll let you know.
Okay.
Okay.
I'll mute myself.
Okay. All right. Jericho, so you want to finish?
So yeah, I think it tends to be clustered more towards the treatment side, specific types of harm reduction, and then a few types. There's a couple of non-medical therapy that it goes for. So of the currently active programs on Nantucket, I can think of 3, maybe 4 that are directly applicable. And that would be Health Imperatives Harm Reduction Program, Addiction Solutions Medically Assisted Therapy. I think there's provisions for peer recovery groups. And then I think it is more on the direct service provision as opposed to outreach or advocacy side.
Right. And we're talking $50,000, correct? Okay.
And it was decided the way that this money was coming out, it was in like $5,000 to $9,000 chunks. Finance was holding on to it till there was a significant amount to do, with the idea being there would be probably from our portion of the total settlement from that court case would probably be 2 roughly equal $50,000 awards for the first couple of years, and then it would be a significant reduction in money going on past that. So finance decided that it was a better idea to collect the money so it would be a more meaningful single impact than small $2,000 to $5,000 grants constantly.
Okay. What brings us to sort of wrapping this up, the grant cycle so far, I believe, and Sue, if you can jump in and add anything, we spent a significant amount of time redoing the application, asking for the things that we typically wind up pursuing after we get a grant application. So we took all those questions and sort of built it in. And there were far less questions. We got much better applications than we have in the past. So we had it right in front of us as opposed to saying, how about this? So I think our pre-work is working out. So what we will be, like I said, next Friday, hopefully we have our deliberations. We did have a number of new organizations apply this time, which was fabulous. So we like seeing new people stepping up on the island. So thank you very much. And we also have some different kinds of programs. So where we are left with, we sort of have decided that we were going to work through this cycle. And when we got to the end of the cycle, we were going to go back to the recommendations from the consultant group. And I think that's where we can start talking about that at this point. Just one thing to finish up with the grant process. We talked about this additional opiate settlement money. The $175,000 that we have had for the past few years, and I think you're probably going on, is it 4 years for that money?
When the dispensary started, yeah.
Will not exist next year.
Oh.
That was money that initially came from a percentage of sales from the dispensaries on the island that was to be turned back into substance misuse programs. I guess, and I don't remember the exact wording on this, but however the money was collected is no longer appropriate, and the government beyond Nantucket has said you can't do that.
I can very, very briefly. Initially, that 175 was collected based on what was called an impact cost, which was what additional costs were incurred by a municipality with the presence of a dispensary, and that was calculated by agreement. The state legislature, as well as the Cannabis Control Commission, I think there might be one more C in there, but they determined that that was essentially fiat, and you had to demonstrate the costs incurred by the municipality with the presence of a dispensary. That was detailed to me. I spent about 2 or 3 months trying to figure out how much it cost, and the only real demonstratable cost I was able to determine was my time trying to figure out how much it cost the town. So that was ruled illegal, and the 175 is no longer being collected from that impact cost because those impact costs were ruled as being illegal.
So if we think about it, that we've had $650,000 for human services grants for a long time. We've had some specific organizations that have been applying and have received that 175,000, which is an additional. That goes away. Those programs don't necessarily go away because they're necessary programs on the island. So at the end of the day, I don't want to say that it may just be an accounting issue, because I don't think it's going to be that. I think it's going to be that we need to make a strong argument for getting more money. Now, I'm going to turn it over to you, Jericho, because our needs study, which is part of what came out of the consultant, we know that we've needed to update that. So can you give us an update on that? Because that's going to be a critical part going forth. The timing is all off, but it is going to be necessary.
So long story short, strategic plan funding was used to retain Raftellus. They did that stakeholder interview and analysis. They did some benchmarking. We accepted the report September, October. We're going to adopt the official report and then have that be kind of our marching orders going forward. It had 2 recommendations. It had a variety of recommendations, but the 2 kind of actionable recommendations that were kind of the enablers for us to be able to do a lot more of their recommendations was a mediated discussion between CHS and CRC to specify the responsibilities between the 2 of them, and then a comprehensive community needs assessment focusing on human service necessities, sort of broader than the hospital's most recent regular assessment. The town of Nantucket and Nantucket in general has not done one since I believe 2012. So it's been about 15 years, where best practices is about a 5-year gap on the outside for how often this gets done. The attempt is to build a system that allows us to do this multiple times, not just a single one-off. So I've worked out um, what is it? Request for bids, an RFB or an RFP, request for proposals. We cross a couple of procurement thresholds with the amount of funding that we have assigned to this. So it has to be a full official procurement process, which means a scope which is written and approved and has been put into the procurement software, an analysis rubric with concrete and objective differentiations between the levels, which has just been finalized and put into the procurement system. And we're going through the final checks because it's a new system and there's always some new things to learn. But that should be going out to bid in the next few weeks, ideally. It's been fast-tracked both by town admin and town finance. So we went from the scope to the rubric to the procurement process in about 2 weeks. Hopefully, we're going to have it out to bid. I also did some, I guess you'd call it market research, hunting for places that have consultancy firms and I guess consultants and experts that have done a variety of needs assessments specifically in this region. I found a few in New Hampshire, a few in Maine that had focused on similar demographics elsewhere and that have a track record of providing actionable needs assessments. And the idea being that we would run the bidding process in the next few, that we would hopefully have identified and secured a contract with someone before March ends, so that we could then start setting things up to run a stakeholder management, some benchmarking, and have at least 2 seasons for this contract to be running, so that there'd be a needs assessment process that began in the end of August and stretched for a few months with primary data collection on island, extending into at least the shoulder season and hopefully into November, December. I think forgive me for an extremely pretentious phrase, the terroir, as it were, of Nantucket's human services needs means that you need to have somebody here for at least a chunk of it, because there is a lot of qualitative stuff here that you're not going to get if you don't, look out your window and see how empty it is from summer to winter. I know that was an issue initially with the GPS behavioral health study. And then once they got here and had some local time, they improved, I think, the end product. But that would be done. The highest possible evaluation mark on the timeline would be that they have a full discrete with multiple deliverables over the cycle of the contract that gives us some information that informs next grant cycle, but that is not going to be a requirement because that might be impossible. The idea is to do a broader and more in-depth comparison with representative communities elsewhere so that we can address that per capita count that we had earlier in the Raftellus assessment, to see if that is actually as robust a finding or if it is as unrepresentative as we think it is. And then to essentially give us objective, it may not be the right word, but discrete and quantitative needs that we can use to inform spending priorities. Essentially, what we would do is we would run this cycle. They would offer a report to us. If they can, that report would be a preliminary report that would help us make decisions for fiscal year 27's CRC grants. And then in addition to that, we would have a kind of a priority list of where spending needs to go until we do the next cycle of the next cycle of needs assessment, ideally 3 to 5 years from now. I don't know how familiar you guys are with the current CRC application request, but it details level 1 and level 2 needs, which is a sort of outdated rubric. And I will pause to let Sue ask her question.
Oh, thanks. Well, I just wanted to put it into context for folks so we've got all these great applications over at the CRC and we don't have, we're kind of flying a little blind. Like, do we need to put more money towards mental health, towards kids' social emotional learning, towards senior citizens, towards food? Like we have no data to make those priorities. And so that is, I think, one of the big goals of doing this needs assessment in very practical terms.
That
Because
and a huge added bonus would be that we're literally going to be able to demonstrate to FinCom ideally the severity and not just the existence of gaps, but how big they are and how they compare to services provided in other areas. It is my opinion, belief, and I believe there is a fair amount of evidence to back it up, is that we spend combined across all of the different funding sources less on human services here than other similar communities in a variety of ways, and that compounds both with the higher cost of service delivery here and more specifically the lack of state, federal, and certain county resources which are not included in the per capita analysis that Ref Tellis did. So that's specifically something I'm going to ask the consultants to examine and address directly. All of that combined should give us both empirical data as well as relative amounts of need that we can take to FinCom and take to the admin and demonstrate that there is an increased need, both to address the shortfall from the 175K, which will probably not be around in the same form, which will not be around in the same form next year, may have some additional life, but I was told to not plan on it existing next year. So that's going to leave a shortfall that the 55K from the opioid settlement is just not going to cover on an ongoing basis. Plus, we average 1 mil plus in requests a year on 650 when we separated it out between the requests like that. So requests is not a great measure of demand or need, but requests coupled with empirical data and then a map of where we're missing things will be more, I think, persuasive in terms of increasing funding for human service spending on Nantucket. Oh, you're muted, Veronica.
One of the things that we had attempted over the last couple of years was to have a listing of the grants that have been received by year and broken down. What I'd like to see is broken down into what category. Some it's pretty cut and dry. So say, I'm not coming up with an example. That something may only be in food, so NIFRA isn't just food because that also does fuel and rental assistance and medical assistance there. But, I'd like to see what we've awarded over the last years and put into those categories. I have some rough scratch notes, but my notes are not completely accurate. So I'd like to work with Lexi over the next, say, few weeks, because I think that's going to be an important document for us to have, that we can see what we've done in the past. And it probably will also be something that the needs assessment people may want to see also.
So, and please stop me if this gets too detailed for people. There's a official federal Health and Human Services taxonomy of services that is those sectors in an official capacity. I don't know how meaningful that is here. So one of the tasks I think outlined currently under the rules and responsibilities of the Council for Human Services is kind of informing the CRC process. That might be a task that because a certain amount of this is going to be us deciding, does this program or does this funding fall here? Because there aren't official rules. There's an official taxonomy, but that's not relevant or directly relevant to us here. So part of the process is going to be us identifying what the buckets are, because when you pick what you measure, you pick what you measure. kind of. You pick the outcomes to a certain extent. So we need to have an informed discussion on what sectors we think everything lands in. And then we also need to address that, and you alluded to this earlier, Veronica, we fund a combination of program and organization. So we need to determine, depending on how granular you want to get, we can dig down and be like, this grant for this year covered this need, and this need. Do we want to split those into each different sector for that year? Or do we want to address it on a organizational basis? Like if it's a Fairwind grant, it's behavioral health. And then we need to decide based on our knowledge of the community and its needs, what those subcategories are. Like what counts as a substance misuse program? What counts as X? What counts as Y? There's good information on that, but that is a level above what CRC should be doing, which is analyzing grants and monitoring reporting and monitoring quality of service provision. That's another thing that as we move forward is going to be a discussion between CRC and CHS, is that ideally, as currently configured, this body, this CHS, determines the priorities and determines the general outline of what processes, what needs the town has. So this empirical data collection process is as much to inform CHS about what we need to do based on your positions, your roles, and then just your place in the community, like finding and assessing needs. And that part of the process, I think, as currently configured, is joint between CHS and CRC. I would like to establish the precedent that CHS is the one that sets the kind of where it should go, and then CRC determines how it gets there. That I think is the breakdown that happened when CHS went away for the better part of a decade.
Right. Okay. Any questions? Okay.
Veronica, I'm sorry, can I just note one thing back to the community health assessment?
Mhm.
I really want to push us as a group to prioritize that and get that done and figure out the consultants. And it sounds like you're totally on top of that, Jericho. I know that when we applied for a navigator organization grant last year, which would have kind of leveled up our community resource specialists' ability to help people with insurance, particularly Mass Health and the Health Connector. The grant that we applied for was through the Health Connector. And though we weren't chosen, I did kind of have a debrief with them after the fact. And they said they just really, the two people, they've been to Nantucket before, but they just did not have a clear sense of the need based on the available data and information that I was able to include in that grant. And, at the time I'm sure I referenced, the most recent hospitals, CHINA, the Community Health Needs Assessment, but just underscoring like how important it is to really, as you said, Jericho, just do this on a regular basis.
Yeah, I mean, 15 years is that data is there's been at least three significant changes in terms of the needs between then and now that cover basically 60 or 70% of the population and services provided here. It's no longer representative. It was used, the socioeconomic system was completely different then. And the real value of this is that this becomes a public document. This becomes a shared set of languages and categories. We saw from the GPS study enormous changes come out of that gap study that, in my opinion, were primarily focused on us using the same language and having the same categories and realizing that our individual problems were shared across multiple organizations. I will be counting on the members of CRC, the members of CHS, NCH, Town of Nantucket admin. This needs to get in front of everybody because they're probably going to be collecting demographic data, which is going to be census based, but part of the scope, it relies on direct data collection here on Nantucket, which is one of the things that that I think is difficult to do. So there's going to have to be stakeholder interviews. Those are going to need to be really well shared. We're going to need to make sure that there is participation at the school. There needs to be all kinds of stuff. That we need to do as the outreach and support, because the worst possible outcome for this is we do this and nobody fills it out and we don't have representative data, and it makes it vastly more difficult for us to A, use what we collect, and B, do this again on an ongoing basis. I've seen a lot of stuff fail via outreach. The best outreach on Nantucket is word of mouth, and the CHS, I think, has a huge role to play, both in directly supporting some of these processes to the degree that members are comfortable with it, and then just to talk about it nonstop. That's really a huge chunk of it too.
Amanda?
Are community members able to participate in this?
So we will. So the way that I've written the scope right now is that it has 3 objectives. One of the objectives is community is a stakeholder analysis or stakeholder assessment, where most likely it is going to be a combination of Likert scale like survey questions and a survey instrument, and then a direct communication with a variety of people in a variety of contexts. There will be forums that the contract would be void and they would have to return the money if they do not run shareholder engagements with regular community members. So that was a long answer to yes, community members will participate in this. It's going to be done by an outside party. Community members would help via word of mouth, via filling surveys, and then participating and listening and stakeholder assessment events, basically.
I know when they did the GPS one, it was difficult to get community members to fill it out. And I'm just wondering if there's any funding, like to provide an incentive to fill it out. Like if you come fill this out, we'll give you a $20 Stop and Shop card.
I will see what we can do with that, but that might be something that I require an external funder, because that violates procurement law, and also would be a concern around, like, what I could imagine happening is that an incentive could be provided by an external agent to help facilitate that. It is not my belief that I'm going to be able to build an incentive structure into that directly to the contract. But when I talk to, like, literally one of the lines is like, one of the evaluation criteria is solid strategy to engage and incentivize participation by community members. There's also, I think, like 2 or 3 lines specifically about linguistic agility, and of the agencies that I've looked at, all of them have a native Spanish speaker like on their
Staff.
like staff, but like as part of, like, as people who are authors of previous needs assessments. I participated in the tail end of the GPS study. It was a really helpful and useful document. I think we could have much more quantifiable data. That was largely qualitative, and I think that was because of lack of participation. So I'm hoping that with enough lead time and a big enough microphone, we can just be shouting this loud enough. We'll have it into as much social media as we are. And then I think one of the other parts of this that's going to be really important is having the nonprofits themselves participate. And I think the ability to use this data to apply for grants outside of current funding structures is one. Hopefully there is a couple of ways we could work out incentive structures. Fundamentally, the municipal governments hate gift cards, and I do not know why. But that is like, that specific type of incentive is a real hard argue for me.
Yeah. And I just think it's important if we can try to do this, like Sarah had said, as soon as possible, because I think when the GPS happened, it was done during the summer and people are so busy, they don't have the time or energy to focus on it.
Yeah, that's specific. Again, another specific line is multi-season. It has to, like, I don't want this to be a vacation for consultants to just pop over for 2 weeks in the summer and then just go on Wikipedia and census.org.
Yeah.
This, I want primary data collection here. I have a decent amount of funding for this, so it should be doable. I think that the realities of the situation is that there's going to be a lot of remote work, and we may have one or two people here for extended period, but I'm going to push real hard for in-person participation or a like serious tight working relationship with a local agency that can provide additional backup for that. But like Amanda, I remember the tail end of that, and I remember some of the responses to it. So I'm trying to do my best to get ahead of that.
So I appreciate all your work on it, 'cause it's very important that we keep doing it.
And I do
Well, I mean,
think that having the not-for-profits understand and participate in this is going to be key, because they're the arms out there that touch people's lives. So I think inviting them maybe as part of this with some kind of a information session, so they're well aware of what's happening and the necessity for it. And maybe they'll have suggestions on how to even reach people. So the more
I'm
people I think
hoping
we can
so.
get involved, the better it'll be.
I'm really looking to find a bid from a specialist who does this. I've found a few organizations where this is their bread and butter. This is primarily what they do. I would love if they did this in a sort of standardized best practices way, so it's comparable or similar to these needs assessment done elsewhere. Because again, that's going to make it easier for us to use this data and to gain funding and to really, potentially even inform state authorities about missing services that they're required to provide. We've found a couple of those gaps where there is a duty or a responsibility that was not being like adequately discharged, or that just wasn't implemented here because it's much more expensive to have state people on Nantucket than it is to have them commute over. So that's one of the things we're really working on. I do want to caution another part of this is I want people who are not active in this, in the nonprofits and human services to participate in this. I want people I want the data to be collected not purely from people who have chosen to be in the human service field, but I want people who are impacted by the consequences of lack of human service spending on Nantucket to be involved. And I think this is an opportunity to bring in a third party that does not have the issues that agencies on Nantucket do with different demographics, and may be able to come at populations that are hesitant to interact with us in a way that is going to get us a much better view of what the actual unmet needs are, because it's really clear that there's a huge chunk of the island who is in need and deserves resources that neither trusts nor participates in most elements of town governance. And a big chunk of fixing that is figuring out how to come to them and how to talk to them. And it might just be that not us doing it is a better way to do it. I saw real quick in the pandemic that once you get an element of trust, and once you interact, and once there is oh, they actually are doing stuff here, you get a huge amount of additional support. The pandemic ended, and so did those structures and networks. Thankfully, the pandemic ended. There's no regret in my head about that at all. But the doing something on an ongoing human service nature means that we might be able to build organizations and structures into the community and into our government processes that are going to not leave a good portion of the island uncontacted or uninteracting with. I think we really do need more communication in that area, and an outside specialist might be the right way to do it.
Um,
Suzanne?
I actually, Suzanne, before I
So when does this data gathering have to take place? What is the time frame?
That's going to depend on the contract specifically. I'm aiming, so there are legal limitations on how long this has to be posted, those are relatively short. I anticipate the bid to be out for 3 weeks to a month. We would then select through those. The contracting process, when it's lined up like this, should be pretty quick. So potentially we could have a contract together by April, May. Then it's a question of working the logistics out. And then maybe there'll probably be some initial meetings in the summertime, but I want to use those initial meetings to be like, well, and the scope on the contract to be like, this is now like, this isn't the part that you need to worry about as much. This is one end of the extreme, but you need to see, like, you need to come back out of summer where people have time to actually interact with you, and then also to see what the situation is and what the needs fluctuate. Because if you only look at the needs in the summertime, it's very different than it is in the wintertime. I think dependent upon the way that this contract is written, it would have to be finished by the end of the fiscal year in which it was signed. If we get the contract together, we could have the contract lined up. We could have them contractually obligated to deliver services in fiscal year 26, which would mean June 30th of this year is when they would start, or sorry, July 1st of this year is when they would start. They would have to end the contractual relationship with the town before fiscal year 27. So they have, 12 months from that date. We could then, we could alter it should the situation be different, should something change that we aren't aware of. But I think most likely we would expect a 1-year cycle on this at most. My dream world is that we would get a preliminary result for this body and for the CRC sometime in November, December. That would just be the categories as they register them and what kind of their assessment of needs is, and that we would adopt an official report probably this time or March of calendar 26.
Right.
So
As we've talked, yeah.
I'm still confused because everything comes down to collecting data and having enough data to say where things go and how much money you need for this program and human services here and all of that. Can't the data gathering process begin anytime?
So theoretically, yes. The issue here is that we don't have the expertise necessary to do this on island in-house. Then we have to pay someone to do that, and to pay someone under municipal finance law, we have to write a contract with set scope and all of that stuff. I've done that. Once we start paying them, they'll start collecting data before they get to Nantucket. They'll compare us to other like communities. They'll use their experience and needs assessments to try and figure out demographic similarities in different regions so they have something to compare our information with. They'll probably do a variety of interviews with town officials and board members to kind of give them the shape of what data they need to collect. The true data that they're going to be collecting on island is going to be interviews with people, so qualitative data, and then a subjective analysis of people's survey requirements, and then comparing them to our spending elsewhere. The data that's going to be collected locally is going to be things like what the spending priorities are or what the spending priorities for agencies already doing this work here is. What are the areas in which what are the legally required services in similar communities that we don't have here? And because of the way Nantucket works, they're going to have to ask a lot of people if those services exist here. So it's going to be interviews. It's going to be emails for a while, and then it should be stakeholder meetings. So, there'll be a room like this. They'll almost certainly come to CHS, ask you guys questions, have a survey instrument that they want you guys to fill out, and then they're going to collect that data and do analysis to see where this survey response corresponds to this lack of spending in this region. And then they'll be able to make kind of complex associations between what we're currently spending now, what services we don't have, and what people desire.
Right. I would
Did that answer your question, Suzanne? I've had my face in this for like 4 weeks, so.
Yeah, kind of, sort of not. I'm concerned about the, yes, I understand we have to get someone from off island to do it, or, to start the survey process. But to touch on the point that you made and Veronica made and that Amanda made, that we need to get input from local groups, people that need the services, etc. How is that going to happen if somebody's coming from off island and they're not talking? And when does that take place? When
So
does
that's
it
what,
begin?
that's a good question. Initially, what they're going to do is they're going to talk to us, probably this particular body. Ideally, that can't happen until the contract is signed. So most
And-
likely, that's not going to happen until the start of the next fiscal year.
Okay.
It might also depend on where where this particular funding is coming from in the Great Town checkbook, as it were. But I want them to be talking to us to get an idea of the lay of the land and who they actually need to talk to collect direct data by June, at least
Yeah.
remotely, so they start thinking it. And then I want them coming here to directly talk to people in meetings September, October, November.
Okay.
And my guess is that they're going to do the demographic analysis. They're going to do something really similar to what Raftellus did as their preliminary, where they're going to, a specialist in this area that is directly focused on needs assessments most likely has a list of factors that they use and they think are representative of community. They would look at those factors here: census population, census demographic breakdown, average home cost, all of those factors, look for similar communities to collect raw data from to compare ours to. Once they've done that, and once they have an idea of what questions they need to ask, by asking us, by asking Select Board, by asking CRC, likely by directly communicating with the big ticket behavioral health, talking to NCH, that will let them build their survey instrument, which is what they're going to deliver, which is what they're going to bring here to ask people to get sort of those numbers of what people need. And then that's where they start to do the data analysis after that. Again, I've never run one of these through from start to stop. That's my understanding of how this process goes, at least how it should go.
Okay. So my understanding, it comes down to we're going to be changing the tires on the bike as we go down the road, because we need to continue moving as all of this is happening. So we will probably be going into fiscal year 27 without having this report. And fiscal year 27 is actually going to be on our request for additional funds. So we need to look at what we have given out. And I know that ask is not really a good measurement, but I think we're going to have to be building a solid um, request without all the data.
Yeah.
And that's going to be a bit tricky, but I think that getting as much anecdotal information that we can is going to be important.
Well, the other thing that I think is, sorry, not to belabor this point, but the other component of this is that when we spoke with FinCom, when we spoke with the Select Board, when we spoke with Town Admin, they all agree the need is higher than what we currently have. The debate is to what degree it is, and how do we know that? That's the big question, because the CRC grant programs have not been doing, like, they don't do data collection in a systemic fashion. So we don't know what the outcomes of programs are, often because of the types of programming mean that there's not an easy or clear way to show that. Also because different agencies are providing radically different services that don't necessarily line up, and partially because we don't collect data in a systemic fashion. Like, in my ideal world, I would be able to right now pop open my OneDrive. I could pop open and tell you exactly how many people received treatment for a particular behavioral health condition 5 years ago. And I should be able to demonstrate how that number is going up or going down. And then I should be able to figure out if we're increasing spending on services working for this, and if that correlates to it going down. We're 4 or 5 years from having a properly empirically informed grant system. This kind of data collection is enormously time consuming when you're trying to do it retroactively. So most likely what we're doing is we're building systems to do grant reporting and analysis thereof as we're moving forward, which will let us in a variety of ways track or at least imply outcomes. That's when this process is done, that's a checking the efficacy of our own services, our own provision.
Okay, Jericho, I have an overarching question here, and actually I'm looking at Sarah and Amanda and folks, Sue, that are directly involved with client. Even though I said I'm not watching what's happening in our new administration, there's a couple of executive orders that I do know have, and I believe some of these will be challenged, but schools, hospitals, churches used to be places that people with questionable immigration status would feel comfortable. That's now questioned, where ICE can go into those facilities, those places where people have felt they can go for services and they're not going to be questioned. And the other factor is we know that even collecting our census data on Nantucket, I think our census is up to, when in 2020 it came out at 14,000 and change. Well, we know that the actual population is more in the 20,000 plus.
I'd say
And I'm not sure what number is actually, because if you ask certain organizations, certain people will give you another number, but I always say it's at least 20,000, 20, 22, 25,000, when on paper it says 14,000. So how, I guess it's, I can't even put it into a question, but I know it's going to affect everything.
I know that both at the state, the county, and the municipal level, I've seen discussions about having a policy on how we want to interact on that. My personal circumstance, and this was something that I have said and have been pretty adamant about since I took this position, is that I don't report, I report nothing. Personally, and I will not participate in any process that I believe is not correct in this area. I know that the population analysis question is an open one. That census counts are almost always undercounts, and that our population are, depending on how you define year round, which there's no real definition for it. It's a aspirational definition, not a empirically measured one. The population on Nantucket is between 19 and 24,000 on a year round basis, based off of primary data collection of things like water consumption and sewage flow rates. Those are not the best measures of it, but in my mind, there is zero chance that the population is below 18,000, and that would be my absolute lowest I think it would go. And that's based off measurements that were done during the pandemic, that put us at 22 to 24 in January of 21. And that would have been just the sewer system, and likely was an undercount based on 55 gallons per person per day, when the actual consumption rate is something like 37 or 39. I know that there are discussions specifically on the state level about what the policy is. We've already had discussions when the migrant plane was sent to Martha's Vineyard. We had initial discussions on what we would do around that. There is a work group that has discussed town policy. I don't believe there has been an official standard made, but it's not something that we in the town or in the state are not thinking about. And it's very clear the state is going to take a hard line. both because I think Maura Healey's personal beliefs as well as her political incentives are such like, and also because we know how much it would cripple our specific state level economy.
Jericho, what is the composition of that work group? Do you know?
So the migrant plane work group was representatives from public service, public health, comms, and admin. That was an ad hoc group that built out of the emergency management service. There has yet been no official work group. I don't know that it's proper to have an official work group on like how do we circumvent the federal government's requests. But I know that it's something that we've been discussing in terms of like what do we do in certain circumstances? What is our standard operating procedure? What roles and responsibilities does each department have? That sort of thing. The actual response to the 2024 election, we haven't had any official meetings past some email discussions of like, should we do this or should we not? But it is something that is actively being looked into both by us on an island level. All of the interagency and intermunicipality organizations I've been had at least one conversation about this post the election, and then it's been something that's been percolating since these sort of things started happening since at least the my start with the department in 2020.
Okay. Oh, okay. Any questions? Okay.
I would suggest and recommend that people look at MIRA Coalition, MIRA. I didn't mention that last time. MIRA Coalition, the Mass Immigrant and Refugees Advocacy Group. They have a lot of great material there about like know your rights, and they have really good, easy to understand PowerPoint slides and stuff for providers that, you know, explain the difference, for example, between Customs and Border Protection and ICE and US Customs and Immigration and all that jazz. So
Okay.
we're going to start putting some of that around the hospital.
Okay. Thank you. Thank you for that resource.
Mhm.
Good. Any other questions? Jericho, your director's report?
Mostly I've already given it.
Right.
A couple of public health related things. There is a lot of flu going around right now. We're averaging something like we're averaging double digits of confirmed cases on a semi-regular basis. So mind your exposure. There's a lot of flu going on. The flu vaccine is less efficacious this year than in many others. And then our vaccination numbers were not particularly high, although we did beat last year for flu, I think. And we can anticipate there being broader availability of flu and COVID vaccines next year in the fall, hopefully, according to the Massachusetts Rural Health Agency or Rural Health, forget what the actual acronym is right now, has transitioned from being an ad hoc work group in the pandemic to now having increasing staffing. And then there's actual a dedicated rural vaccine program or office. So we should be seeing better work in that area, hopefully. And then past that, what's the other big human services stuff? We are going to be.
How about norovirus?
So we don't track noros separately. When I said 22, when I said varying double digits, but between like 17 and 22 for flu, it's because those were confirmed antigen tests that were through the hospital or through another reporting agency. Noro is not tracked separately most of the time. So I don't have a solid number on that, but RSV, RSV, COVID, flu, and noro are all going around. I think most recently it's influenza A, which anecdotally has been hitting a lot of people who did get flu shots very hard this year. So it's going to be like any respiratory disease, there are going to be spikes around vacations. We're probably in the height of our post-holidays one. Expect another cycle of this after February vacation, potentially another one after the subsequent school. The subsequent one, I think, is an early March vacation, although that one always is the smallest of the three major vacation cycles. I think that's. I'm
Beside
sorry.
all of those things, there's just the common cold that also is going around and getting you. So it doesn't have to be one of the big names. There's viruses out there. So be careful. It's dangerous out there. Um, anything else, Jericho?
Probably, but it's the brain. She's Jello.
All right. What I just want to circle back around is we are going to be scheduling a meeting between CRC and CHS and looking probably to do that the end of March. And I don't know if availability with this group would be that if we move the meeting to a Friday morning. I know that there's certain CRC members, that's like the window that they have available. And I want to get everyone to be able to participate. So if you can maybe think about it, send an email, if it's this time on Thursday, or if you're available Friday morning from 9 to 11. And we'll see if we can get the most participation. So if you can send an email to Jericho, that would be great.
And then I'll talk with Lexi well ahead of the February meeting. We'll have some candidate dates that we work out. Veronica will work out with CRC and with some members here, and we'll send some polling days around to see if people will have like a preference. I figure if we lock it in nice and early, it should be manageable. Although if anyone has large gaps in availability around March or early April, let me know and we can monkey around with where the actual date is.
Okay. Do we know when school holidays are? Is there a school holiday in March?
I can't remember.
There is in April. I just asked yesterday. I asked Tandy about this because we were talking about some upcoming speaker slot times for the healthy community, community collaborative luncheon. So I thought the school vacation week in April was like the week of the 15th with Patriots Day, but she said no, it's the week after, like the 21st, 22nd. And then I don't think we talked about February.
It's end of February, right?
I think February, like around President's Day.
It's the end of February. It's the last week.
February, and then beginning of March.
Yeah, it spills over into March.
Yeah.
So I think it's end of February and then beginning of April, you just said, Sarah?
I think it's the third week, like 21st.
It is.
Okay. All right.
And the library is going to be closed the last week in February too, because we're having all our floors redone.
And that's during school vacation week then?
It is. That's why we planned it. That part of the reason why.
Okay. It's probably the quietest week on Nantucket. That last week when school is closed. We think it's quiet now. It really gets quiet then. All right.
I was just talking about that today.
Yeah.
I'll be here.
Yep. Likewise. I will be here for that.
I might actually make it off the island.
Oh, are they going to let you back on? That's the question.
This is why I don't leave that often.
All righty. Any other business? Well, actually, we had left as a item community human services related items submitted by CHS members. Is there any update on programs or anything that anyone would like to give, briefly? The warming place I know is up and running.
Up running 7 nights a week, 2 days a week. We've increased our numbers this year. The cold snap has certainly
Yeah. okay.
encouraged more people to come, and
Okay.
we're glad to have them.
Sue, what are the numbers like?
We have about 8 people overnight now on average. We've seen 20 odd different people overnight. Some people kind of have places that they crash, work sites or whatever. So like it's a little bit variable, but there are definitely people who come every night.
Good.
And we have bigger numbers during the day often. People come in for lunch. They get on Mondays, we give out Stop and Shop cards, so that's an incentive.
Mhm.
Actually, Amanda, you would probably know what Mondays look like better than I do.
Yeah, no, I think Mondays are busier than Thursdays.
Yeah.
Okay. And that's the distribution of cards, et cetera.
Mhm.
Have you started the showers yet? Has that started yet?
I think that's starting
Okay.
this week or next weekend.
Okay. Similar topic, but I've seen a lot of advertisement about the host program for island youth up to age 24. Does anyone know if there's Jericho?
So I've actually that was a Rosemary from Community Solutions for Behavioral Health found that agency. We've had an Homelessness Prevention Council member coming on a semi-regular basis. We've embedded somebody in our house to act as a caseworker for youth homelessness, and then we actually ran 2 information sessions last week or 2 weeks ago, just after the start of the year, that we had a couple people come to. But the program we're going to do a few more with additional advertising that just runs through the program. We have a video component of this that we're going to have together for sharing. Essentially, this is I think it's a 6-month program where rent is paid to a landlord on behalf of a youth, defined as 18 to 24, that is referred to that program from a provider of some sort. So there's a degree of vetting. It's not an adoptionship program. There are some mentorship components to it, and there's additional services offered by HPC, offered by Department of Mental Health, I believe, through HPC. So there's work skills, there's a bunch of additional services. It's not just a rent support thing. And then if a relationship or a renter-tenant agreement is still acceptable to both parties, at the end of it, the individual can continue to live there on their own rental process. But the idea is this is like a life skills and respite from circumstances that allows young people to get their feet back under them and develop both marketable skills and a good working relationship with someone and a roof over their head. The funding for that's together. We'll have a variety of sign-up ways. You can contact Community Solutions for Behavioral Health or me, and I can put you in the right direction to start the process. It's not an immediate shelter thing. You will have at least, I think, a month of warm-up time. You will have both parties choose who they're going to have, with the idea being that there's it's not a desperation move. And then has been some additional services for emergency youth housing supply or housing supplementation that are also part of that, that are being run through our house's case manager.
Mhm. Okay. Wonderful, wonderful. So lots of good things happening for sure. This is also something that we heard during our interview process with CRC, and I have not substantiated this, but maybe Amanda, I was told that in the past year, we have not had one overdose death.
Yes, Dr. Lepre had shared that with me last week.
Yeah, yeah.
I think the original source on that was the police department. So that actually aligns with a massive massive drop in overdose deaths in statewide, like to the tune of like 80+%, I think.
Wow.
Yeah, so the new Narcan program rolled out last year, and it's too early to do the full analysis of that, but it is a very safe bet that, well, it's 100% that there's a relationship between the drop in overdose deaths and the Narcan program. The question is how much of that drop is due to the Narcan elements, and that. By the way, there is a widespread free community access to Narcan on Nantucket. There's a variety of places you can go to get Narcan if necessary, and there's some training being done on an ongoing basis. Again, Community Solutions for Behavioral Health is on that one.
Yeah, yeah. So this is all good news. All good news. Maybe a little bit soon to do a happy dance, but I think it's going in the right direction for sure. So. Thank you all involved. Any other community things to share?
I just want to just let folks know we have a good transportation work group that's been meeting for the past couple of months, and we're making some good progress there. So I think we're going to invite the High Line and or the steamship to one of the next upcoming meetings. And that's been just very collaborative and enlightening.
Yeah. Speaking of collaborative, one of the issues that we have seen with the Contract Review Committee and reviewing grants, last year, one of the things we talked about with all the applicants is collaboration, because it is a necessary component of many, many grant parameters. And this year we have seen some incredible collaboration happening between organizations. So where people said, oh my gosh, this can't happen, people aren't going to, well, it's happening. So all positive things that are going on. So I feel like we're chipping away at it little by little, but our goal is to have a healthy, prosperous environment for all. And I think that we're making some baby steps to get there. So thank you, everyone. Any other new business or any other business? Okay. With that, our next meeting will be February 27th at 4 p.m., which the last Thursday of the month. And it's 5:26 p.m. So if anybody would like to make a motion to adjourn.
So
I'm
moved.
sure. Oh, second. All right. Let's have a vote on that then. So we'll start down with the bottom on my screen here. Suzanne?
Oh, wait, I'm sorry. I just went somewhere else. What's
Okay,
the question?
motion to adjourn.
Oh, yes, yes. I was just thinking I'm having surgery that week and I don't know if I'll be at the February 27th meeting, so I'll let you know. But
All right.
yes, we can close this one.
Okay, thank you. Sarah?
Yes.
Kelly?
Yes.
Tara?
Yes.
Amanda?
Yes.
Sue?
I gotta run.
Okay, and
I know.
and
5:30.
myself, yes. Thank you, everyone. Have a great evening. Good seeing everyone, and keep the faith.
Thank you.
All right.
Thanks.
Bye.
Bye-bye.